Hello, everyone. I want to welcome you to our presentation for medical care at home, or the product we've called as MediHome. My name is Chris Franz, and on behalf of our entire group, Sarah Waterhouse, Jonathan Davidson, and Michael Phillips, we just want to thank you for taking the time to review our presentation and see what we've been working on for the last 8 months. I think you're really going to enjoy it. A brief overview of what we're going to talk about today is just explain to you a little bit about what our product is, current solutions, what the market looks like. We're also going to talk about how we plan to make money on this. We're also going to tell you what we think it's going to cost, and more importantly, why. So the million-dollar question is why? Well, if you look at the picture below, all of us have had this moment of struggle at one point or another in our lives. Whether it was for ourselves, with kids, we've gone to the doctor, we've tried to get care, and we have received subpar service. So that's why we developed MediHome. So because of what you just saw, we thought to ourselves, there has to be a better option. And not only does there have to be a better option, but we can change it so that way you can get care from your home in a way that is convenient and cost efficient. The MediHome app is going to be a one-stop shop. You're going to be able to complete your medical history online. You are going to be able to have your information available in the same place. You're also going to be able to schedule appointments and communicate directly with your doctors through the app. In addition to that, you're going to be able to access your pharmacy and have deliveries made all in the same place. So everything sounds really great so far, but you're probably asking yourself, what makes us better than everybody else? So if you recall, Aetna and CVS recently merged, and part of that was to create synergies between the insurance company and the facility itself. And seeing how well this worked for both CVS and Aetna, we want to take the same approach. So MediHome is going to partner with Blue Cross Blue Shield, or Premera. This partnership with Premera creates an immediate advantage for MediHome. Companies like Teladoc are going to have an added level of service for every transaction. With our extension of the insurance company itself, it's going to result in less time, less money, and less stress. So with that, we're going to transition into differential value with Sarah Waterhouse. And I'll see you guys at the end of the presentation to wrap it up.
We conducted 2 CBC studies to evaluate customer reactions to our offering compared to current options on the market, Teladoc versus traditional brick-and-mortar doctor offices. We looked at a variety of factors to determine whether or not MediHome had sufficient differential value to be competitive. Using the CBC study, we found that our brand and product is one that customers want. Through the different attributes, we've developed a product with enough differential value that will get customers to switch from their current solution and use and choose MediHome for their healthcare needs. The chart shows that customers significantly valued product 1, MediHome, compared to product 2, Teladoc, and product 3, an office doctor. In the same survey, we discovered that price was of most importance to people. While our service is not the cheapest option, our utility was slightly higher than the cheaper alternative, which tells us the additional cost is worth the service being provided. In reviewing brand preference, it appears people want to be able to manage and have service in their home, so the name MediHome resonates well. People feel indifferent about Teladoc. It may be that they've never tried the service, or don't believe they will receive the care that they are looking for, or some other factor. In reviewing the utility scores for location, people like the idea of in-home visits. If we can provide in-home visits at a lower cost than going to a medical office, we will be able to provide substantial value from a switch dynamics perspective by creating a new solution and use that customers will enjoy. Generating social value, aka positive externalities, is important for business organizations for a number of reasons. By taking an active role in helping to solve societal problems, a company can effectively improve its own brand image, increase customers' willingness to pay for its products, and generally create value around an issue. Using the customer demand model and social value canvas for the proposed solution, our platform MediHome can offer significant social value with a limited impact to the cost structure. Based on the results of our CBC study, we know that customers would be willing to pay more for our service over the next best solution. Although we are aware of the customer's willingness to pay, the ultimate goal is to do so at zero cost. Healthcare costs represent the most major stress to Americans, second only to money overall, according to a 2018 Trans-America Center for Health Studies survey. By consolidating medical history in one place, in our app, consumers will also be assured that any doctor knows their entire history, which can make a life-saving difference. MediHome also provides a job opportunity that will especially appeal to recent medical school graduates, improving a community's workforce. In addition, MediHome allows people to use less sick and personal leave away from work, a social and economic benefit.
Hello, my name is Jonathan Davidson, and I'm going to walk us through our business ecosystem and discuss any potential risks we may have. Here's a look at our ecosystem blueprint. For MediHome, step one in creating a new product offering is to hire an app development company to create our all-in-one app. While that app is being developed, we're going to reach out to the medical field to make them aware of this app we're creating and try and gain advertisement dollars to help offset the development costs of our app. Once the app is complete, we will push our app out to medical specialists and pharmacies to try and gain some early adopters with our app so they'll be connected to customers once customers are signed up to use our service. The next part of our product offering is the in-home doctor care. To do this, we first need to hire doctors. Once we have those doctors hired, we're going to reach out to retirement communities to try and gain a big base of initial customers so one or two doctors can go service a whole community. And while that's going on, we'll push our product out to the general public and try and make them aware of our in-home doctor care and getting a customer base that way. From there, we reach our end customers, and those customers will then feed back to our medical specialists, pharmacies, and advertisers and help complete our ecosystem blueprint. The app developer is the first part of our ecosystem blueprint. Though they are a third-party provider to us, we're saying it's not creating any operational risk because we don't have this product and service today. We want to get our all-in-one app out there, so to mitigate any delays, we're going to create a production schedule with an amenity clause to control the timing and the release of our app. Doctors. This is the most important step in our ecosystem blueprint. If we can't find suitable doctors, quality doctors, that provide the care our customers expect, we have a hard stop constraint with this new product offering. The mitigation plans we're going to put into place are to work with medical schools to make recent grads aware of the service we're trying to provide. We're going to create a great benefits package with a flexible schedule and competitive pay to try and draw the best doctors around to work for us. Following in-home doctors on our ecosystem blueprint are the retirement communities, and these are just as important as the doctors. Retirement communities will provide a large starting customer base to offset the salaries of the doctors we're hiring. Without retirement communities signing up for our service, we could lose revenue quickly in the first few years trying to get our product out there. To mitigate this risk, we're going to heavily recruit discount programs in the retirement communities by giving them discounts based on the number of customers or patients we will service in those communities. Medical specialists are only a slight risk to our vision, which we consider a moderate constraint. We want offices to use our app so we can sync up better for processing and payments, and this will also allow customers' history to be synced through the app so customers don't have to fill out paperwork every time they go to an office. Through our conjoint survey, though, we found that this is not a priority feature customers must have, so we don't have a mitigation plan in place if medical specialists decide not to use our app. Pharmacies are next on our ecosystem blueprint, and we've given them a moderate constraint. Again, our customers have told us through our conjoint survey results that they don't mind filling out their paperwork and it doesn't have to be connected in our all-in-one app. However, for us at MediHome, we want to offer a medication delivery service. And to do that, we want to partner with a couple select pharmacies that are close to our customer base. The benefit for the pharmacy is that it'll help them generate a base set of sales, and they'll know what medication is coming at them so they can quickly stock their shelves. For MediHome, this will help us have a quick turnaround for our customers' medication and get deliveries out faster. Lastly, on our ecosystem blueprint are the advertisers, and we valued this as a moderate risk. Now, advertisement dollars are not a critical revenue stream to our product offering. However, it would help offset some of the operating costs for the app. To make advertisements work, we want to find creative ways to put advertisements in our app that won't inconvenience the customers while using the app, but will be beneficial for MediHome as well as companies advertising in our app and let customers know about products out there to help their medical needs.
A big question you probably have is how will MediHome make money and make Premera more profitable? There are multiple revenue streams and cost savings that MediHome will bring to Premera. One of our revenue streams is actually a cost savings. By hiring our own doctors to help our customers, we will save on average $75 per doctor visit. Instead of dishing out $225 to the doctors of private practices, we will instead pay on average $150 to our own doctors. In addition to the cost savings by using our own doctors, MediHome will offer pharmaceutical deliveries for a $30 per delivery charge. On top of that, we expect to get revenue from offering advertising on our app. Lastly, when MediHome is a success, we expect other insurance companies to want to use our service and will be receiving a service fee from them. So to reiterate, we have 4 streams of revenue: advertising, service fees from other insurance companies, pharmaceutical deliveries, and the cost savings by paying our own doctors instead of paying other doctors. By being a part of Premera, MediHome will allow Premera to at least partly integrate vertically by moving into the service of providing doctor services. We expect to see 20,000 pharmaceutical deliveries in the first year, and at $30 a delivery, revenue from deliveries should be $600,000. We expect to see at least $100,000 in advertising revenues in the first year. Additionally, we expect to see $50,000 in revenues from other insurance companies who wish to access our service. The majority of our revenue will come from the in-home doctor visits at $225 per appointment. We expect to perform $15,000 per year, which will bring in a total of $3,375,000. All revenue streams combined, we expect to see $4,125,000. Now, after seeing the revenues, we must understand the costs and how MediHome is going to make Premera money. Now we will talk about MediHome's pricing model and how we plan to bring Premera to the next level. Like I said before, MediHome will receive most of its revenues from its end-use customers. As shown earlier, this will come from the $75 savings we will be getting from providing our own doctors instead of paying other doctors to give a lesser service, and from the pharmaceutical delivery fees of $30 per delivery. Additional revenue will be generated from other businesses from advertising fees and other insurance companies using our service. To figure out that our solution would see quick adoption, we performed 2 CBC studies with 100 respondents. From our first CBC study, we found that customers would be willing to pay more for our service over the next best solution. The next best solution's attributes include: when contacting the doctor to ask a question, you call the doctor office and have the nurse call you back. You fill out insurance information and answer medical history questions at each different doctor's office or pharmacy. You go to the doctor's office after or during work and at a lower price of $300. The $300 was only for surveying purposes, which showed us that customers are willing to pay a premium at a price of $400 for the service we are offering. Our service compared to the next best solution was preferred by 70% of our respondents. We did also discover that price is also very important to our customers, so that is why we decided to offer our service of in-home doctor care at no additional price to the customer. The big question I am sure you are pondering is, how much is this going to cost Premera? Well, there is one large fixed cost of the app development of $194,500. This will be performed by a third party to minimize the cost and to develop the best interface. The first year's cost includes $60,000 for technical support, $75,000 for customer service, $100,000 for sales and marketing, $528,500 in pharmaceutical delivery costs, $1.5 million in doctor salaries, $150,480 in mileage costs for doctor's visits, and $750,000 in doctor supplies. The first year's expenses come to a total of $3,358,230. Now that we have discussed revenues and costs, we can now get to what is on everyone's minds: profits. Since the first year we have a one-time fixed cost for the app development, we will see profits of $776,770. We expect revenues to increase 10% every year after the first year. Direct costs associated with pharmaceutical deliveries and doctor's visits will also increase by 10% each year. But we expect the indirect yearly costs such as technical support, customer service, and sales and marketing will only increase by 5% due to synergies through Premera.
And this is Chris Franz back again to wrap it all up. So no doubt you've heard a lot of information about MediHome today. From what it's going to cost, to how we're going to pay for it, to the variety of providers that are going to be involved in making it all happen. The bottom line is that this service is going to provide a great value to all these customers on the right-hand side of this line. So not only is MediHome going to provide a service that people want and need, but it's going to have a lot of social value as well as positive economic impact. So I want to thank you all again for watching our presentation, and look out for MediHome app.